Welcome to Cancer Conversations with OHC, our regular discussion with our OHC cancer experts. My name is Joni Monzo and I'll be your host today. I am extremely excited about our live Facebook today. As many of you know, September is Ovarian Cancer Awareness Month. And so today's discussion is going to be around ovarian cancer, signs, symptoms, how you can hopefully reduce your risk, but also learn from the experts as to how we are treating this type of cancer. And today we have Dr. Danae Wren, OHC's gynecologic oncology expert, and with her a lovely patient, Taylor Harris, who is here today, who is an ovarian cancer survivor. So welcome both of you. Thank you so much for making the time.
Thank you, Joni.
Thank Truly appreciate it.
Thanks, Taylor.
Dr. Wren, we know that only 15% of ovarian cancers are diagnosed in the early stages. Can you explain to our viewers why this type of cancer is frequently diagnosed in the more advanced stages?
Absolutely. And again, I wanted to thank Taylor for coming today. It's an honor to have you here.
Oh, thank you guys. I appreciate it.
Ovarian cancer is a tough cancer to diagnose because there are symptoms that are often overlooked. So women may feel bloating and just think that they are, having gastrointestinal problems. But the other issue is with ovarian cancers, there's no screening test. So if you think about some other cancers like breast cancer, we can screen with a mammogram. Ovarian cancer does not have a screening test, and this makes it very difficult for us to detect it in the early stages.
So Dr. Wren, you talked about some of the symptoms of bloating. Are there other symptoms that women should pay attention to?
Absolutely. So something that we often comment on is a BEAT acronym. So B-E-A-T. So I mentioned bloating. So that's the most common thing where women will feel that they're getting a little bigger around the middle. That's what we might call bloating. Eating less, that E word or E letter stands for eating less or feeling full quickly. The other thing would be abdominal or pelvic pain. And then the last letter for T, we think about trouble with urination or perhaps problems with your bladder. So that's just an easy way for us to kind of think of the symptoms. And I usually say if these last for about 2 weeks or longer, then contact your physician so that you can kind of get a better workup to why you're having these symptoms.
Good information. Taylor, can you share with our audience a little bit about your cancer story and what your symptoms were?
Yeah, I would be happy to. So I was diagnosed with polycystic ovarian syndrome, where my ovaries were having cysts on them. And due to having those, I was actually having the severe bloating, the abdominal pain for months on end. That's just the very basic symptoms of it. So I had a previous surgery, and unfortunately they couldn't remove the cysts, so they sent me to Dr. Wren, and she had worked with me for months, and then she decided we should go in and have surgery to remove the cyst off one of my ovaries. And while she was in there, she actually discovered a mass, and unfortunately it came back as ovarian cancer. So she made the decision to do a total hysterectomy. And she also took out, I think it's 22 specimens of cancer.
It was a lot.
I looked into it a lot. But, I'm thankful that she made the decision to do so. And it's crazy thinking I was just going in for a very simple procedure at the beginning, but coming out with something so complex and something that you don't see in someone my age.
And what age were you at when you were diagnosed with?
So I was 25 years old when I was diagnosed.
Okay.
Yeah.
Very young.
Very young.
Yeah. Dr. Wren, Taylor mentioned the PCOS, and also they discovered some endometriosis.
Yes, they did.
Are these risk factors for ovarian cancer?
That's an interesting question. There are other things that can be associated, I would say. So PCOS or, even more so endometriosis can be associated with ovarian cancers, but what we often find is that women may have other issues as well too. So again, I know Taylor was quite young when she was diagnosed, which is rare. We normally see women at more advanced ages, maybe postmenopausal women, but also women who may have experienced other issues like fertility problems. And then also we think about somebody's genetics. So there may be things in someone's genetic history that may put them at an increased risk for ovarian cancers. I would say someone who has PCOS and endometriosis, they are going to be followed closely because of those problems as well, but they can be associated with other things such as fertility problems, and then maybe later on associated with something like ovarian cancer.
And I know, Dr. Wren, in previous interviews, you've mentioned smoking obviously can be smoking, obesity, those sorts of things. Are those also risk factors?
Yes, smoking, somewhat so, and we do see that, but the more common thing, like you mentioned, obesity, is something that we do sometimes see with ovarian cancers as well. And again, going back to family history has become so important for us to hopefully try to diagnose this and try to figure out which patients we should be paying a closer attention to, since we don't have screening tests.
I know you mentioned that half of ovarian cancers are found in women age 63 and older, and that about 4% of cancers are between the age of 20 or 24. 20 to age 34. Are you seeing, though, a trend of younger patients coming in with ovarian cancer?
It's interesting. I would say from anecdotally, I've had several patients kind of near Taylor's age range, women below the age of 40 that have been diagnosed. And I'm not sure if this is because hopefully we are looking at certain things, again, family history, but then also doing more ultrasounds. And when, physicians are seeing something that's abnormal, being a little bit more aggressive with, trying to delineate what is going on. My hope is that we don't continue to find these in young women, but if we do find them, I'm hoping we will find them at earlier stages.
Very helpful. Taylor, what advice would you have for young ladies your age in relationship to what you went through and advice?
I think my biggest thing is to be an advocate for yourself. I understand that can be difficult at times. You want to have the best feeling when you're going and talking to your doctor, and your doctor does know a lot of things and they have a lot of experience, but everyone's body is different. So if it's not normal for you to be having, like she said, more than 2 weeks of severe abdominal pain or bloating, then that's not normal for you. So I think it's just very important for a woman to advocate for herself and really trust her gut. You know your body. If something doesn't feel right, you know it's not right. So go see someone, go see your physician. If it's not working out the best and you just truly feel like you're not being listened to, then I really advise you go see a second opinion. That's not a bad thing. That's okay. You're taking care of yourself.
Good advice. Dr. Wren, can you talk a little bit, when you are seeing patients that are young, about fertility preservation and how you work that into the care that you give to patients?
Absolutely. So if there is an opportunity for us to explore someone's desires to having, future children, we would like to explore that with the patient. Obviously, if it does not coincide with the robust treatment that they need, we will have to make some really tough decisions. But we have wonderful reproductive endocrinologists that we work with that can help with either egg preservation or egg freezing. And then also we can work with embryos as well too. So these can be an option. And again, when we are finding something early, it does allow us to be able to, help with the infertility issues that may arise. Again, this is something that has to be a conversation with your physician, and if someone's not happy with those options, seeking out a reproductive endocrinologist to find out what the options are for fertility preservation. And then also we have some patients that pursue adoption if they are not going to be able to have children after surgery or treatment.
Okay. I know that you touched upon genetic testing, and Taylor, you had genetic testing.
I did.
Correct?
Yes.
And what were the results of that?
I did have one genetic mutation that came back. It does have to do with the ovarian cancer gene and also with colorectal cancer. So, in a way, it's really nice to know about the genetic mutation. It's kind of like, it's terrifying to know that you have one, but now that I know about it, I know the things I need to watch for, the signs and symptoms that could be wrong. So, I think it's wonderful that I got to do it. And now, even since I had it, my family actually as well got to be tested, and my brother as well tested positive. So as sad as that is, but it's also, now it makes me happy because I'm like, okay, now you know what to watch for as well. So this doesn't have to be like a huge surprise. If something pops up, we know to get you in a doctor, explain everything, and get on the right track with it.
When should a woman start considering genetic testing?
Yeah, so that is tough because you have to think about what are you going to do when you find out the information. The first step is to know your family history. Now, some people do not have the luxury of knowing that. They may have been adopted, so they don't know their family history very well. But if someone can figure out if there are cancers in their family, that will allow them, number one, to consider getting genetic testing. We have genetic specialists at OHC who are willing to see our own cancer patients, but then also if someone else wants to make an appointment with them, we do that as well too. For someone who wants to get genetic testing, if they have a strong family history of cancers, I usually say wait till childbearing is over, or if you feel like you're ready to hear the information and you want to take steps, I say looking at age of 25 or a little bit older, when you're ready to actually hear what options you have. If someone has a genetic mutation and we want to try to screen them, even though there's no screening test, let's say for ovarian cancer, we may follow them differently with ultrasounds or with CA-125, which is a tumor marker. So there are things that we can do. I just think sometimes it may be a little bit, too much for someone who's, a teenager. Although we do find some ovarian cancers at really young ages, that may be too young for someone, or for them to hear at that age.
Sure, it's good information. So we know that with surgery, obviously in chemotherapy, you can treat ovarian cancer successfully. Could you share with our audience some of the PAR inhibitors, some of the treatment options now that are available and having success?
Excuse me. Sorry, I might need some water.
Okay. We actually have some. There you go.
Sorry.
Yeah, that's okay. And I know that Taylor, you had chemotherapy.
I did, yes.
Besides surgery.
Yes. So I had 6 rounds of chemotherapy that included 3 different drugs on board, and then after that I completed 15 rounds of maintenance chemo that had 1 drug on board, and I actually just finished my last round of maintenance chemo 3 weeks ago.
And you look wonderful. And how are you? And how are you feeling?
Right now I feel pretty much back to normal. The maintenance chemo was a lot more tolerable. I think it only put me down for about a day where I'd feel kind of achy or have a headache, but normally about 48 hours after, I was feeling pretty good with maintenance.
That's amazing.
Yeah.
Absolutely.
I think I can answer your question.
Okay, that's
Sorry.
right.
I needed a second there. So in reference to maintenance treatment, I thought I was ready. You mentioned PARP inhibitors, right? So PARP inhibitors, as well as Avastin, are maintenance type of chemotherapeutics that we use. And let's go back to your question again. I'm gonna
Sure. No, that's absolutely, because I think one of the things that OHC is aggressively involved in is clinical research. So we have done a lot in the forefront with obviously CAR T, cellular therapy, with bispecific antigens, the BiTE, but now with a lot of the immunotherapies that we're seeing that are coming out that we have been involved in research. There are more options for patients, and hopefully some of these treatments have less harsh side effects. And obviously the genomic, or the very personalized medicine that we offer, because it's very important to look at a patient's specific tumor, because everyone's tumor reacts differently to treatment.
Absolutely. So when we talk about PARP inhibitors, that is a medicine that is different than the chemotherapy that we used to use, or that we still use. And PARP inhibitors are a pill form. And so the way PARP inhibitors work, we do, as I mentioned, use them as maintenance, but we can also use them in the recurrent setting as well. And basically we are manipulating the tumor's ability to try to kind of survive, if you will. So PARP inhibitors kind of look at a molecular and genetic level, and what it will do is try to prevent a cancer from being killed. So that's what the PARP gene does. And so if we inhibit that gene, then basically that tumor will die because it doesn't have its survival mechanism. So we want to inhibit the PARP so that basically the tumor cell can't survive. If we give PARP inhibitors to someone who's already had chemotherapy and use it as maintenance, or use a drug such as Avastin, then what we're able to do at that point is hopefully extend the amount of time that someone can be cancer-free and decrease the risk of recurrence.
Okay. And it has changed, I'm sure, in your career, you've seen such a difference in how we're approaching many GYN cancers and the treatments that are available to patients.
Absolutely. Before drugs such as PARP inhibitors or immunotherapy, even Avastin came along, we always used the same two drugs to treat chemotherapy. And that's what we've really had for a very long time for a newly diagnosed ovarian cancer. And so now I think we're moving beyond our traditional drugs that we use, and we are kind of exploring different avenues to be able to attack a cell, looking at the molecular level of ovarian cancer, kind of trying to figure out what each personality of the ovarian cancer is. So Taylor's ovarian cancer may not be the same as someone else's. And so if we can find out the molecular makeup of a tumor, then that will help us to use drugs such as PARP inhibitors or other drugs, immunotherapeutics, to be able to target the cancer in a different way, and then hopefully be able to really get someone a cure for cancer.
Great information. I know that you use a lot of community resources to help women who are going through cancer. Can you mention a couple of the community agencies, like Cancer Family Care?
Yes, absolutely. So Cancer Family Care has been wonderful with providing support not only to the patient but also to the entire family, as their title states. I'm also on the board of the Ovarian Cancer Alliance of Greater Cincinnati, and the group has grown a lot over time, which that kind of lets us know a few things. There's more awareness about the group, but then also we're having more patients and families that are diagnosed with ovarian cancer and then joining our group. So the Ovarian Cancer Alliance has events throughout the year. We just had a walk not so long ago. Taylor was there, and so it was wonderful to see our patients. And then some of our patients who are no longer with us, their families still participate. And we also have a gala coming up as well too, in October, and we're excited to kind of present a video that Taylor has been participating in, and I can't wait to see it. I'm in it too,
Yes.
but I can't wait to see the final product for that.
And that is, I think it's their 9th annual. It's Jeans and Jewels, and I believe it's October 1st, and it's at Receptions. And so if anyone is interested in still getting tickets, they can go to the Ovarian Cancer Alliance website, because you can actually register online. And I was talking to Diane Weedman yesterday, and she said their live auction is going to be online starting September 25th. So.
Yeah.
And I know that that's something that OHC works closely with the Ovarian Cancer Alliance, with Cancer Support Community, Cancer Family Care. But I know that there's something near and dear to Taylor's heart that she's involved in.
So I actually just joined a group. It's called Women to Women. So I will be able to meet with someone who is freshly diagnosed with ovarian cancer. Hopefully it will be someone closer to my age. Since there's not a lot of us, it can feel isolating at times, and I just, throughout this whole situation, if I can just be there for someone who has to go through what I've gone through, then I feel like I'm making at least one good stride in this cancer disease.
Absolutely. And you just being here, I think, gives so many people hope.
Thank you.
And knowing that we are beating cancer.
Yes, we are.
Thank you so much,
We
Taylor.
appreciate you.
No, thank you guys
absolutely.
for having me.
And thank you, Dr. Wren, for
Yeah.
taking time out of your busy
Absolutely.
day. If you would like to learn more about ovarian cancer, or if you'd like to learn more about OHC clinical trials or any of our doctors, please visit ohcare.com or call us at 888-649-4800. We will have a live Facebook next month on breast cancer, so please follow us on social media, OHC Facebook, and that's where you'll get the latest updates. Thank you so much.
Thank you.
This has
Thank
been
you.
really, really helpful. Truly.